Guys, it's Joel, and I wanted to make a quick video and kind of go over a lot of the reasons that people don't go to therapy and debunk some of the biggest myths that I see. And I see these come up a lot, so I hope that's helpful. But I mean, number one is that a lot of people don't think they can afford therapy because they've heard that it's $200 an hour. They ask what a private pay rate is for somebody, and then they feel like that's overwhelming, or they've heard something from a friend. But I mean, most therapists have a sliding scale if your insurance doesn't cover them at all. If you're on a very limited income, then that sliding scale usually goes down pretty low. I have a lot of friends who do therapy and have waived copays for a long time. I mean, sometimes there's limitations based on, where you're working, but a lot of the people that are just, four walls and a door, over their own shop are able to adjust their rate to suit your situation. So I definitely would call and ask about that. But also, with payment, I mean, a ton of people come in whose insurance covers therapy with me like 100%, but they put it off because they don't think it does. So, I mean, you have nothing to lose by calling and asking. There's also a lot of free alternatives. There's a lot of nonprofit counseling centers. I mean, if you want to go to therapy with anybody, cost isn't going to be an issue within reason. It can be expensive, just like anything else, but it doesn't have to be, and that's not a reason that you should put off treating PTSD or something serious. Also, I think the second big reason that I see people avoid therapy is because they're afraid that they have a preconceived notion about therapy. They've seen some movie or The Sopranos, or they read about Sigmund Freud in college, and they think that therapy is going to be them coming in and then crying about their mom for a really long time, or the therapist is going to make them cry, want them to be sad. And I mean, if that's true of your therapy, unless you like that, then find another therapist, because that isn't what therapy looks like most of the time. It can, I guess, in certain situations, or if you want it to, but for the vast majority of people, it doesn't look like that. And therapy, the therapist is not going to push you to do something you're uncomfortable with. Healing is challenging, but they're going to make sure that you understand the process, that you know what's going on, that you're sharing things that you believe and think, and not putting ideas in your head or something like that. A lot of times people have associations from movies or something about what therapy is, but there's a lot of different kinds of therapists. I mean, I see people where I do Jungian depth psychology kind of dream analysis, and we're talking about what they want to become over the course of their life and looking at their dreams. I have PTSD patients, and all I do is EMDR or an eye movement therapy like brain spotting and somatic kind of cataloging what their body's doing, and I just help them process a traumatic event, and then they're gone. And they don't want the other stuff, and it's not what I do, because it's not what they want, and it may not be what they need. So, find the therapist that's a good fit for you, but no, it shouldn't look like whatever you think it's going to look like, because you've seen something that made you uncomfortable on television. The third reason, and probably the biggest reason, is that people think that if they go to therapy and then they find out that the therapist can't help them, then that means they can't get help. And it's kind of a subconscious thing where we say like, well, right now I know that I'm having a hard time, but if I go to therapy and then the therapist tells me that he can't help me, then oh my gosh, I'll really know that I'm beyond help, and so I'm going to put off figuring that out. It's like when you think something's wrong with you and you don't go to the doctor. Well, one, no, none of you are beyond improving the quality of your life. No one is. Two, if the therapist can't help you, find another therapist. There's a lot of them, and it's a very varied profession. So I wouldn't let that be a fear that keeps you out. The second big reason that I see people, not the second, what am I on? So the secret and fourth reason that a lot of people won't say, but I think it's good to acknowledge, is that there's a lot of therapists that are not good or have been damaging to some people. And it's okay. I mean, there's people who are bad at every profession. I think it's all right to admit that as a person who's a member of that profession. So they've heard some horror story from a friend, or that you went to therapy and you had a terrible experience and you were like, I don't want any more of that ever again. I've had a therapist that was bad. As somebody who now is in private practice doing therapy, like I had somebody who was extremely damaging and disrespectful, and it was not a good experience. I've also had a therapist that really deeply changed the direction of my life and what I thought I was capable of and how I saw myself in the world. So, avoiding therapy because one therapist did a bad job is like never going to a restaurant again because you didn't like the macaroni and cheese at Macaroni Grill or something. I mean, there's a lot of different styles of this, and there's a lot of different people, just like there's a lot of different patients. So I mean, the biggest rule of thumb for not getting in a situation like that, I think, is making sure that you feel comfortable. I mean, it's very hard to make something like trauma treatment fun or exciting or easy. So you may not enjoy every second of it, but if you don't get it, if it's weird, if it makes you uncomfortable in a way where you don't feel like you're getting out of your comfort zone, but you're just getting more and more confused, then get the hell out of there. Don't go to that therapist and find another one. And that includes if you come into therapy with me. I mean, I try and explain to patients what I kind of hear them saying and kind of how I would approach that problem. And also explain that, you know, if that doesn't work, then we'll put that method down and we'll try something else. But if I don't make you comfortable, if you feel weirded out in therapy with me, I am happy to refer you to somebody who I think might be a better fit, or, I mean, that is fine. And anybody at all in this field that is professional one bit should understand that they are not the best person, they are not the best therapist for every patient. Just like all of the different techniques and interventions that I have are not the best fit for everybody. Nothing is. And so if you find somebody who's a little bit more open like that, I think you will have a good experience. So it looks like I'm about to run out of time, so I want to say goodbye, but thank you. If you have any questions about what style or person or anything about anything that I said would be right for you, just send me a comment and I will get back to you as soon as I'm able to. I hope everything's going great and y'all be safe. Take care.